Good afternoon, members of the Anti-Female Circumcision Committee. This afternoon, I would like to very briefly report on the findings of the practice of the female circumcision and discuss ways to prevent such atrocities from continuing to plague the women of countries such as Africa, Asia, and the Middle East. For those of you who may be visiting us for the first time, female genital mutilation includes procedures that intentionally alter or cause injury to the female genital organs for non-medical reasons. However, families who introduce this treatment upon their young women and girls do give religious impurity and chastity as reasons for carrying out the procedures. The World Health Organization estimates that between 100 million and 140 million girls from ages infancy to 15 will undergo this procedure and have been subjected to female genital mutilation. The World Health Organization also cited a few statistics regarding this practice. They are as follows. FGM is mostly carried out on girls, sometimes between the ages of infancy and 15. In Africa, an estimated 92 million girls 10 years and above have undergone female genital mutilation. FGM is a violation of the human rights of girls and women. There are no health benefits that are derived from having this procedure done. In fact, there are major causes for concern, as well as prolonged health concerns that follow this procedure, such as recurrent bladder and urinary tract infections, cysts, infertility, an increased rate or risk of childbirth complications, and newborn deaths. Also, there's the need for later surgeries. For example, this procedure will seal or narrow the vaginal opening, which then needs to be cut open later to allow for sexual intercourse and childbirth. Sometimes it is stitched again several times, including after childbirth. Hence, the woman goes through repeated opening and closing procedures, further increasing and repeating both immediate and long-term risks. To get a better understanding of the reasonings behind such heinous crimes against women, let's delve into a few of the reasons given for FGM. The first reason, FGM is said to reduce a woman's libido or sexual appetite, which helps her to abstain from sexual relationships without the benefit of being married. Although the cause is theoretically honorable, there are more humane ways of preventing illicit sexual affairs, some of which include sexual education and parental guidance. Perpetuation of the practice is becoming socially acceptable. Not only is this one of the weakest reasoning points for this continuation of this practice, it fosters the idea that we as people have to conform to the whims and desires of society, when in reality we have only to abide by and conform to God's standards. The third point. Some proponents of FGM also consider the victim to be morally clean after the removal of body parts that are considered to be male. It's as if society believes that all women were somehow created with flaws. And when I say society, I mean societies that practice female genital mutilation. Our last point. There are groups of leaders who would and do greatly benefit from circumcision, such as religious leaders, circumcisers themselves, and the medical personnel. These are some of the greatest advocates for the continuation of such horrible practices. Though we as Americans are not affected by such atrocities, we should keep in mind the horrible suffering and daily horrors of those who are helpless against such violence. The issue of FGM should never fade into the background. It should continue to be a topic of World Health Organization leaders and hopefully will soon be discontinued. Thank you and have a great afternoon.